Alright, ask the question, what size crop needle would I use? I'd start with a 12. 12's a pretty good size for this bird. The end of the crop needle on a 12 will not fit down the windpipe of a sun conure. I don't care about anything else. I'm only worried that the end of the needle, the ball of the medication tube, might go down the windpipe. If I can pick a medication tube with a ball big enough that it won't, I'm as safe as a bank. I also, with a bigger needle, have much less chance of penetrating any tissue. In fact, a bird this big, you could use an 8 gauge on. I'm not going to. I'm going to go with a 12 because that's about as small as I would go. Alright, the other trick, we're into tricks today, the other trick with giving a medication tube is to be able to roll the needle in your fingers. Okay? You need to be able to do that. So you don't hold the syringe, you hold the needle. 2 fingers behind, thumb in front, and be able to twirl it. Because the twirling allows us to move tissue out of the road just as we advance the needle down his throat. Pretty simple, but it's a little trick. Rather than just trying to push, we just use a bit of a twirling motion, and it really allows us to pass that needle down very easily. Okay, so now this is how we go about it. Righto. I'm right-handed, so I have to come in from the bird's left side. Come in at an angle like so. When you get close to the beak, most birds will bite. They bite the ball. Now the twirl, I roll up and over. Now I've rolled it up and over behind his tongue. Okay. Now I'm back to, see that twirling motion? As I twirl, I'm just very gently advancing the ball of the needle down his throat. I can now feel that needle on the left thumb. I can feel the ball of the needle through the skin on the left thumb. So down here, I can actually feel it. So I know I'm in the right spot. I also know how deep I am down the neck of the bird. So I want to go down to about approximately the level of the knuckle of my thumb. Okay, so I go down to there. Now I've advanced the needle that far, I can go back up and squeeze the food or the medicine, whatever I'm giving, in down the crop tube. Now to get it out, it's a reverse of the process. I just very gently wiggle it, the bird will let it go. Now just notice what I've done here. I've left my thumb pinching off his esophagus against my finger on the other side. Okay, I've got my thumb on one side, my finger on the other. In fact, his windpipe is just here, just in front of my thumb. Why do I do that? Well, if I'm giving the bird fluid or I'm giving the bird food, I can pinch off his esophagus, stop it coming back out of his crop up into his mouth before I let him go. So I pinch his throat off, then I can put the bird horizontal in the cage and let him go. No chance of him then regurgitating and swallowing food or taking food into his lungs. Okay? Just a simple pinch-off technique. Once you've done it a couple of times, you'll see what I mean, and it really is worth learning how to do, because otherwise you've got the bird on his back, you've got a crop full of food, and he regurgitates it, and next thing he's inhaled it. So pinch his throat off as you go, let the bird go, put him in his cage, give him a gentle little nudge away from you as you let him go, otherwise he bites you on the finger. Okay, we did the conure, let's have a look at a budgie. This is an original bush budgie, one of the wild budgies. These are little birds. What size crop needle are you going to use for this little guy? Me, I'd go with a 16. I think a 16 gauge will fit fine in this little bird. Techniques are all the same. Okay, we'll go over it again, thumb up underneath, finger around the back, bird laid in your hand, just held gently. Don't get carried away, go gently. That's one of the other reasons that I don't like gloves, because you don't have the feel. You can't be gentle. You've got this great lump of leather between you and the bird. If you're doing something like a black cockatoo, a macaw, an Amazon, a really big bird, and it won't fit in your hand, what do? You go and get a towel. You wrap the body of the bird in the towel, but this hold up here, it doesn't change. It stays the same. It stays the same for all the birds. Righto. Now, let's go. Same principle. Here we go. We twirl the needle again. I've just got a small syringe on this one. Okay. Principle is the same. Here it is. Alright, so we come in from the side. This little guy's not going to bite, but we just hook the top bill, pop it over the back of his tongue. Okay, there he goes. He's just swallowed it. Do the see, notice the rolling, gentle roll. I've straightened that needle up now so that it's in line with my thumb. You see that? Straight line stuff, straight line. Down we go. We're down to roughly the level of the knuckle of my thumb. I can just feel it in there. Reverse back out. There it goes. Pops out of his mouth. I've left that thumb and finger in place again for why? Stop him regurgitating. Once I'm happy, put him in his cage, let him go. Righto, let's have a look at a real little one, little baby Zeb. This is only a young Zeb, he's not long out of the nest. Crop needle size, ta-da, we're going to use an 18. About the only time we use an 18 is in these little guys, little finches. Funnily enough, the nature of the hold stays the same. Obviously, we're not worried about being bitten, but remember what I've been saying about this is that you need to straighten the neck. And if you leave that thumb in that position that I'm talking about, it allows you very gently to straighten the neck and take out the S-bend. Okay? No way known are we going to get the ball of this needle down the windpipe of a Zeb finch. That's okay, we're not worried about that. It really just is a matter of being able to get it over the back of his tongue. Big thing with finches, not just Zebs, but finches as such, they have a very small crop volume. Do not try and put too much into the crop of a finch. It'll just flow straight back out. I generally try not to put any more than about 0.25, 0.3 of a mil. Crop volume is probably more than that, but that's my rule of thumb, that I don't get any more volume than that. Because if you do, you'll end up drowning him. All right, let's see how this works. Same principle as before. Okay, a little bit hard to show you here. All you're going to see are my hands, I'm afraid, but here we go. Okay, now these little guys generally won't bite at the needle, so what you need to do is put it on their bottom bill, then tilting their head back up a tiny bit, push up with the needle till it catches the tip of their upper bill. Right, that opens his mouth, pull it back into his mouth, over the back of the tongue. Notice I've just straightened everything up again. There it goes. Twirling. Guess what? We're twirling again. Feeling it on the ball of my thumb. I'll roll him around that way a bit for you. Feeling him on the ball of my thumb. Okay. This time, obviously, we're not going way down here. We've come down to about, I guess, the bottom of my thumbnail. But there it is. Okay, so I've given the dose of whatever I want to do. Reverse the principle. Out it comes. Bit of a twirl. Back out his mouth. Thumb, finger trapping so that it doesn't flow out. There we go, buddy. We're all done. Okay, look, I've shown you a conure, a budgie, a finch, all pretty much the same. You can go up to cockatoos and macaws. It's not hard. Just go up to the bigger needle, bigger syringes. Speaking of bigger syringes, trick number 27, whatever we're up to. When you've fitted your crop needle onto the syringe and you've wound down the knurl and you have it nice and firm, don't take it off again. Undo it when you're cleaning it. Take out the thread out of the end of the needle. Saves you having to reset this each time. Sometimes it can be a pain to get these things to sit properly, so I actually undo them at that level. All the syringes that I use when I'm giving food to birds, are actually all drilled out with a 3mm drill bit. This area in here is the smallest point in the whole system, or the narrowest point in the whole system. If I drill it out, then if I'm giving hand-rearing food or some other sort of food that I'm trying to give to a bird, it's not going to get caught in the nozzle of the syringe. So just drill it out with a 3mm drill bit. Okay, so these sort that we have are already pre-drilled. All right. So look, you can do any bird, doesn't matter. The birds such as kookaburras and magpies, any of those birds, they're easy. They have really big gullets. You could put a piece of garden hose down their throat without a drama. So just go straight to an 8 gauge. When it comes to the parrots, you need to think about your gauge size. Remember what I said early on, biggest size that fits. Be gentle. Be gentle with your hands. Learn to be able to hold and be able to feel what that bird is doing in your hand. If you can do that, you won't have any dramas. Just ease that crop needle in, that twirling motion that we showed. Just ease the crop needle in. Go for feeling the end of the ball on the tip of your thumb through the skin of the bird? Yeah, piece of cake. You'll do it easily. Good luck to you.